COVID-19 pandemic has had a profound impact on every aspect of our lives in a way that may not be fully realized for many years to come. Since before the mandatory shutdown, your local intermediate units and school districts have been working hard to reopen schools. We have an obligation to make sure that our plans are inclusive of the different and unique needs of our communities. Our guiding principle has been and will continue to be prioritizing the well-being of our students and community, and to have everyone return to our building safely. As educators, we rely on our state and local health departments to guide medical decisions.
As the County Health Director, my job is to provide public health leadership to Chester County and Delaware County. The COVID-19 pandemic is a medical issue that necessitates us to provide public health guidance in our area, but we need your educational leaders to have an active role in helping us understand what works and doesn't work in the school setting. It takes medical experts and educational experts to bring students back into schools safely, which is why it is so important that we work together. As we navigate the pandemic as a community, we are thankful to our intermediate unit and school district leaders for working alongside the health department to inform school guidance and make the best decisions for students in Chester County and Delaware County.
Both our local education leaders and health officials know that there is not a one-size-fits-all solution for the COVID-19 pandemic. That is why we are working together across county borders to provide guidance to better serve our diverse communities. By developing strategic mitigation efforts in collaboration with the Chester County Health Department, we are focused on establishing guidelines that fit the unique needs of each and every school. We cannot do this alone. Now more than ever, it is critical that we come together so that intermediate units and school districts can continue to provide equitable and quality education to students across our region while keeping students and staff as safe as possible. COVID-19 knows no borders, or county borders or local borders. Working together towards strategic solutions is key in providing a safe environment for all, our students, our staff, and families.
There is nothing I want more than to welcome the students back into our buildings. Having the support of our county health department and our educational leaders makes me confident as a building principal I have the strategies necessary to keep our students and staff safe.
As a school nurse who is one of few health professionals in our building, the knowledge that our community leaders are working together to keep our students safe is reassuring to me. I know that I can depend on them to provide the best guidance for our school and the most up-to-date resources for our students.
Providing medical guidance to our educational partners helps everyone from school principals to teachers to school nurses to effectively do their jobs. We are leveraging the resources, assets, and processes that we've established within our region to inform decisions at the local school level. This is an ongoing partnership with our educational leaders, and we will continue to work together and evaluate the health and safety of our students even after the buildings reopen. Our top priority is not just to get our students back in schools as quickly and safely as possible, but to keep them in the schools.
We all have a role in bringing our students back to school safely.
It starts with us. Together, we can create a safe environment for all, staff, students, and families.